Are you on a statin? Write in the comments. There are patients who get muscle pains due to statins. It's not the vast majority of patients, but yes, it happens. And as a family doctor in practice for a lot of years, I have seen this. What I will say is that if you have muscle pains and you're on a statin, it doesn't necessarily mean your muscle pains are due to the statin. So I do want you to keep that in mind. But today we're talking about CoQ10 specifically, the role that CoQ10 plays with statin-induced myopathy, and whether taking CoQ10 will help prevent or treat any muscle pains you have due to your statin. Guys, it's good to see you. I'm Dr. Jen Cottle. Just as a reminder, a statin is a class of medication, a cholesterol medication that many people are on for multiple reasons, not just lowering cholesterol, but heart health, etc. Okay. Now, you should first know that the mechanism by which statins can cause muscle pains, muscle cramping, muscle toxicity is not well understood. What that means is we don't know as a slam dunk exactly why this happens. We have a lot of theories and we have a lot of proposed mechanisms, and I'll tell you some of the slam dunks that we do have at the end of this video, but we don't have a lot, okay? This video, we're talking specifically about CoQ10 and its role. I'm going to read to you some information from UpToDate, which is a medical source that a lot of us doctors use. I just think that they say this in a good way, and so I want to sort of read almost verbatim how they talk about coenzyme Q10. First of all, you should know that coenzyme Q10 is also known as CoQ10 or ubiquinone. That enzyme, coenzyme Q10, plays a really important role in muscle cell energy production. The theory is that lowering ubiquinone or CoQ10 in muscle may cause statin-induced muscle injury, okay? And not only that, individual statins may have effects on the synthesis of CoQ10, okay? Now, the thing about that is that some studies have found that statins decrease concentrations of CoQ10, but other studies have not. So you see that there are different conclusions that different studies have had about whether statins in and of themselves decrease the levels of ubiquinone, also known as CoQ10, in skeletal muscle. So that's the first thing you need to understand, is that sort of debate or that question, that sort of discrepancy that we have. Now, despite this, there are many doctors who recommend taking CoQ10 along with statins. I've even seen commercials about this on TV. I do not, and I do not because the evidence I don't feel is there. But do I have a problem with my patients taking it if they want to, if they feel it's helpful? Not usually. There actually have been some studies, some data, some case reports that suggest that people do feel better in terms of their muscle pains with CoQ10 when they're on a statin. But just like the last information I told you, there are also studies that say, well, no, people have also said it doesn't seem to matter whether they take CoQ10. Once again, the data is mixed about whether CoQ10 seems to help. According to UpToDate, which is my source for this video, UpToDate does not recommend giving CoQ10 to try to improve or prevent statin-associated muscle events, okay? As we discussed before, yes, it's possible that CoQ10 may have a role in statin myopathy, but the data is mixed, and we don't have a lot of great evidence that shows the benefit of CoQ10 supplements for the treatment of muscle pains or myopathy, okay? So this is the thing. Even though UpToDate, and I agree with this, and other sources don't recommend CoQ10 to be taken along with statins to prevent muscle pains, there are some things we do know. We do know that the risk of muscle pains with taking statins is higher in certain people. Number one, higher potentially in people who take certain statins. Those statins that inhibit CYP3A4. That's lovastatin, simvastatin, and torvastatin. They may have a higher incidence of muscle pains. Pravastatin, pitavastatin, and fluvastatin appear to have less muscle toxicity than other statins, okay? Also understand that we tend to think that muscle pains risk tends to be higher with the higher dose of the statin. So lower doses of the statin tend to have less risk of muscle pains. And then also you should know that certain conditions increase the risk of statin-induced myopathy, like certain genetic conditions or musculoskeletal conditions, even things like an underactive thyroid or kidney disease, even certain liver disease, okay? So some people, just because of their underlying diseases, may be at risk, higher risk for muscle pains when they take a statin. Now, there are things that can be done if you have muscle pains when you take a statin. And this is something I go over with my patients, and I've done multiple times, like so many times over the years, right? Number one, the statin can be changed. Okay, maybe if you're on a statin that's more likely to cause muscle pains, your doctor may consider changing it to a statin that's not as likely to cause muscle pains. Maybe your doctor may change the dose, lower the dose. Maybe they'll tell you to take it every other day. They may also check your vitamin D levels and make sure your vitamin D levels are up to snuff, because potentially, like inadequate vitamin D levels could potentially increase your risk of statin-induced myopathy. Okay, your doctor may also check for medication interactions, because yeah, statins can interact with other medications. The other thing, though, is, as I said in the beginning of the video, is that your muscle pains may not have anything to do with your statins, which is why I say before you stop your statin or do any of that, don't assume that the muscle pains are due to your statin. There are a lot of conditions, underlying conditions, that can cause muscle pains. So you want to talk with your doctor to get sort of an idea and start investigating what's going on. There are also labs that your doctor can check to see if your muscles are being injured. They may want to check for autoimmune diseases, and the list goes on and on and on. So keep this in mind. Also know that if you do have muscle pains due to statins, there are things we can do. I have other videos on statins and statin-induced muscle pains. I'll link them here. Just message me if you don't see them. I'm Dr. Jen. Please share this video with others. Write in the comments if you're on a statin. Also, please subscribe to my channel on YouTube. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp. Please sign up for my free health newsletter at drjencarl.com.